is Morleen from Filipino Institute CNA. I'm going to talk about autism spectrum disorder. It refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, like speech and nonverbal communication, noise and loud sounds affects them. There are 5 types of autism. We have Asperger's disorder, Rett syndrome, childhood disintegrated disorder, Kenneth Syndrome, pervasive development disorder. I'm going to talk about what is Asperger's syndrome. Asperger's syndrome is often obsessive interest in one or two subjects. A child usually focuses on one thing. Like this toy, they give all their attention to one thing. This is that's Asperger's syndrome. There is Rett syndrome. It only affects girls and usually shows at the age of 6 months old. And the symptoms include repetitive hand and arm flapping and delayed speech. There is childhood disintegrative disorder, CDD. Usually starts regressing at the age of 2. We have Kenneth syndrome. This one is a classic autism disorder. Difficulty in communicating and understanding with others, and usually they have got even when others are talking like same age, it's really difficult for a person with this disorder to communicate with others. And what causes autism? It could be having an immediate family member with autism, genetic mutations like from generation to generation, from your grandfather, grandmother, like it keeps rotating. That's genetic mutations. Metabolic imbalances, a history of viral infections in the family. And what are the symptoms of autism? We have delay in language or social development, restrictive repetitive patterns of behavior, like keep doing the same thing, playing with the same toy, doing the same thing again and again and again, rigid adherence to specific routines and behaviors, it's like fixated interest or preoccupations in one thing, specifically in one thing. Like mostly they like to play with dinosaurs, they want to play with toys. Whatever toys, whatever they are playing with, specifically like every day, like making it in a routine, everything, it's an everyday thing, you really need to seek help. What are the treatments of autism? We have behavior therapy, we have speech language therapy, we have play-based therapy, because it's really hard for them to interact with other children of their age, so you need to take your child for play-based therapy. There's physical therapy. For most importantly is to keep in mind that the routine is important and the program should be designed in a way that can be sustained. If it's time for breakfast, make sure it's the same every day. You should maintain the routine. Breakfast time, lunch time, play time, you should maintain that so that they will get used to it. Because if a child have got autism, you really need to seek help. Thank you very much.